Hello everyone, welcome to Slides to Clinics. Today we'll be talking about a totally different topic, which is more about the anatomy of the human hand. And we'll be focusing on the bones, the ligaments, from the wrist all the way to the fingertips. Just to make it a little bit more organized, we'll be breaking things down into three main parts. The first one is where we'll be talking about the bones. The second part will be more about the ligaments, and finally we'll be talking about some real life clinical examples. So let's get our hands into it. Let's start by having a very quick look at this clinical question. So we've got a 24-year-old patient who had a fall on an outstretched hand. Went to the hospital, had an x-ray, and it came back that everything was good. No fracture. However, the patient still complains of pain around the anatomical snuff box. What do you think is wrong with this patient? Now at this point, you could pause this video, have a think through what could be the problem, and at the end of the presentation, we will get the answers. I have a very small hint at the base of this slide, which says, remember which bone forms the floor of the snuff box. I'm pretty sure majority of us have selected the correct answer. So let's dive into the main presentation. Now this is an overview of the anatomy of the hand. And if you have a look at the hand, we'll all agree with me that the hand is a masterpiece of mechanics. The hand has 27 bones packed into each hand, and these forms the wrist, the palms, the fingers, and basically allows for everything from having a very strong grip to zipping a cup of tea. Now, what holds all this together is a network of ligaments, which we could refer to as the body's natural duct tape, and you find them all over the surface of the hand. So for this presentation, we'll divide the ligaments into three parts. The first part will be the ligaments at the front of the hand, which we regard to as the palmar side of the hand. And then the second one will be the back of the hand, which we also call the dorsal part of the hand. And then the collateral ligaments, which basically hugs the finger at each side, basically for support. Let's start with the bones of the hand, alright? Now, it's easier to say the bones of the hand are the scaffolding of the hand. And for us to understand them very well, it's easier to group them into three categories. The first category are the carpal bones. So, what are the carpal bones? The carpal bones are a group of bones, 8 in total, which is divided into two rows. The proximal carpal bones consist of 4 small bones, and then the distal carpal rows also consist of 4 carpal bones stacked on top of the proximal carpal bones. The proximal carpal bone connects with the radio-ulnar joint, while the distal carpal bones connect with the metacarpals. There's a mnemonic which we could use to remember the carpal bone, but excuse my French, because some lovers try positions that they cannot handle. So if you look at these mnemonics, the first letter from each word actually mean or named as a bone. So for the proximal row, you start with the scaphoid at the thumb side, then the lunate bone, tracheometrium, and then the pisiform. There's a quick fact about the pisiform, because the pisiform is actually a sesamoid bone. And sesamoid bones are bones that live inside a tendon. So it is basically the overachiever of the wrist. Another important thing to note is at the proximal row, only the scaphoid bone and the lunate bone actually team up with the radius to form a wrist joint. The other two small carpal bones doesn't contribute to the wrist joint. Now, the next thing is the carpals and the phalanges. The metacarpals are 5 long bones that make up themselves in the palm, and they are numbered from 1 to 5, starting with the thumb down to the pinky. Now, each metacarpal has a base, has a shaft, and has a head, and they functionally give structure and serves as muscle anchors for finger movement. The other one are the phalanges, and we have 14 phalanges in the hand. Each finger has 3 phalanges: the proximal, the middle, and the distal phalanx, except for the thumb, which keeps it very simple with just 2 phalanges. All phalanges have the base, shaft, and head layouts, and these small bones make up the joint of your fingers, what we normally would refer to as the knuckles, and they allow for the precise movement which everybody in most cases takes for granted. Now, to sum this up, the bones of the hand can be categorized into 3 groups: the 8 carpal bones, the 5 metacarpals, and the 14 phalanges. And the summation of this gives us the 27 bones in the hand. That's a lucky number. Now that we've had a look at the bones, let's talk about the ligaments. The ligaments are basically the body's built-in ties. They keep the bones connected and at the same time stops the joint from doing things that they really shouldn't be doing. And literally, we can classify these ligaments into 3 types. Now, the first part or the first type are the palmar ligaments, which are the ligaments found on the palm side of the hand. Now, these are tough guys. They are very, very tough guys. At the wrist, the palmar, radiocarpal, and ulnar carpal ligaments basically connect the forearm to the carpal bone. Now, there is a simple way of understanding the structure and functions of these ligaments. If you look at each ligament, they always comprise of the name of the 2 carpal bone, which they are either stabilizing or holding together. So in the radiocarpal joint, you will have ligaments attaching the radius, which is a wrist bone, and one of the carpals, right? And these are ligaments found at the palmar side of the hand. One important factor to note about the palmar ligaments of the hand is they are very strong and they basically restrict the movement of the hand going backwards. The second type of ligament are the dorsal ligaments. And think about this. If you flip the hand over to the back, the ligaments which are found there are called the dorsal ligaments. They are not as strong as the palmar ligaments. It's safe to call them the beefy ligaments, but they still do what they're meant to do. They hold things down literally. Now, they help to keep the wrist very stable, especially during the movement of flexion, where the palms get close to the forearm. Then the third type of ligaments are the collateral ligaments. It's safe to call these ones the side stabilizers. At the wrist joint, you have the radial collateral ligaments, which is at the side of the thumb, and then the ulnar collateral ligament, which is at the side of the pinky finger. Now, just like every other part of the body where you need stability, you always have the collateral ligaments. So, and when we're talking about the hand, because we've got two main bones, the radius and the ulnar, so it's safe to call the collateral ligament based on the side of the radius or the ulnar bone. And this is the same thing that happens in the finger. So at the fingers, every knuckle has a collateral ligament on both sides. They are very tight, especially when the fingers are bent. Just think about it. When you're trying to make a fist, the fist always feels very rock solid. And one of the functions of this ligament, the collateral ligament, is to ensure that your grip, your fist, is as tight as it could get. So in summary, the ligaments, according to what we're talking about now, can be categorized into three. The palmar ligament, which helps to reduce hyperextension, which is exaggerated extension. The dorsal ligament, which helps to reduce overflexion, and then the collateral ligament, which helps to reduce the sideways bending. Now, this is at the basic level, and in the next few presentations, I will be talking more about the wrist ligaments, which we have a proper discussion and more anatomical description of these ligaments. Now, here is where it gets real. Just because as much as we love anatomy, it's often the injuries that brings people down to the clinic. So let's look at three different common fractures involved in the hand. To begin with, let's have a look at the scaphoid, which literally is the wrist drummer's coin. The scaphoid bone is the most commonly broken carpal bone, and this happens when someone falls on an outstretched hand. Falls on an outstretched hand. The pain sometimes shows up in the anatomical snuff box, and this is because the scaphoid bone is actually at the base of the anatomical snuff box, and that in turn is the answer to our quiz question. Now here is the catch. The blood supply to the scaphoid bone actually comes from its distal end. So if there was a break around the middle part or the proximal part of the bone, what it simply means is the blood supply gets cut off, and then the broken pieces of the bone eventually dies off, which is a term called avascular necrosis. The reason why the scaphoid bone is very important is because once the fracture happens and it's missed or not easily diagnosed, it becomes a pain in the hand. There's a clinical golden nugget which says the scaphoid fractures can hide on x-rays. Anyways, check the snuff box. Then, the second thing we want to talk about will be the boxer's fracture. This is a fracture of the fifth metacarpal, the pinky's head bone, what we normally would refer to as the pinky finger. As seen in the presentation right in front of us, the fracture naturally occurs at the neck of the knuckle. And anybody would ask, why is it called the boxer's fracture? And this is simply because it is usually happened when people punches the wall. Sometimes it could be a door, or occasionally when you've made bad decisions. The knuckle looks sunken, and most cases needs a splint, because once the fracture happens, it has to be immobilized. And the third thing we're talking about is a Bennett fracture. Now, if you look carefully at the slide right in front of us, you see two different pictures showing two different fractures. The first one is the Bennett fracture and the other one is a Rolando fracture. So to start with, I'll talk about the Bennett fracture. And this is one of the fractures that actually involves the base of the thumb metacarpal. So if you look at the presentation in front of us, you could see the thumb bone and the metacarpal. In the Bennett fracture, it's just a simple fracture. However, in the Rolando fracture, there are two fragments, which tells us it's more of a complex fracture. And that is clearly the difference between the Bennett and the Rolando's fracture. Now, many cases of this type of fracture needs to be managed surgically, because once it gets done, it gets very difficult for the patient to utilize their thumb. And we all know that the thumb is very important to the functional movement of the hand. And it's easier to say a weak thumb means no grip, no game. The bone gets all the attention, just like in a day-to-day experience in the accident and emergency. But the ligaments have their fair shares of drama as well, especially when they're pushed behind or beyond their limits. The first ligamental injury I'll be talking about will be the skier stump. And in a nutshell, this simply means the tear of a ligament called the ulnar collateral ligament, also referred to as the UCL. If we take a few steps back, when we were talking about the ligaments, remember the collateral ligaments, which are the ligaments which stops or limit the side-to-side movement of the small joints in the hand. And that's what happens here. Now, the ulnar collateral ligament is the collateral ligament which is more at the inside part of the thumb. Now, how does this happen in a skier? Imagine someone holding a ski pole and unfortunately tripped and had a fall. This eventually makes the person fall violently and applies a pressure at the inside part of the thumb. In many cases, this pressure is strong enough to rupture or damage the ulnar collateral ligament, and there is where the name came from, the skier stump. Just like every other ligament damage, the first thing you always notice is pain at the inside part of the thumb. And because the thumb is very functional to day-to-day activities, the patient will also present with weak grip and some swelling. In some cases, it could be a partial tear, which means it could be managed conservatively, but extreme cases need to be seen more acutely. The next injury looks a little bit similar to the skier stump because it's basically the same ligament. However, the difference is the mechanism of injury. While the skier stump is more of an acute or traumatic injury, the gamekeeper stump is a chronic overuse injuries. So for people who use the thumb in awkward positions for a long period of time, they could also injure the ulnar collateral ligament. But in this case, we wouldn't call it a skier stump. We will term it as a gatekeeper stump. So a bonus fact is that a chronic version of skier stump can be called a gamekeeper stump. Same ligament, just injured as a result of repetitive usage. Like I mentioned in the previous slides, I'll be having subsequent videos on the ligaments of the wrist. However, I'll just give a little or very brief explanation on wrist ligament sprain. Now, something peculiar about the wrist is it has more ligaments than the Game of Thrones plot, and one key player is the ligament called the scapholunate ligament. And guess what? Just as it's named, it's a ligament that links the scaphoid bone and the lunate bone, which is very important. Now, when this ligament ruptures, there will be what we term as an instability in the wrist, which in many cases is very difficult to diagnose and also difficult to manage. But stay tuned and wait for the subsequent presentations where we'll talk more about the different type of ligaments in the wrist. We also have some small ligaments in the fingers, like the collateral ligaments or the volar plates. However, to sum this up, ligaments might be small, but they punch above their weight. They keep the hands very stable, precise, and powerful. An injury like the skier stump always reminds us of how crucial they are. So guys, let's bring it all together. Because the hand may be small, but its anatomy is anything but simple. The hand framework includes 8 carpal bones in the wrist, 5 metacarpals in the palm, 14 phalanges in the fingers. That makes a total of 27 bones in the hand. And supporting these bones are strong ligaments, which we've classified as the palmar ligament that stops hyperextension, the dorsal ligaments which resist flexion, and the collateral ligaments that prevent the side-to-side chaos. Clinically, we also looked at the scaphoid fracture and their snaky blood supply. We looked at the boxer's fracture because walls don't lose fights, and then the Bennett and the Rolando's fracture, which are thumb injuries that could mess up with your grip. And don't forget, we also talked about some ligamental injuries involved, like the skier stump or the gamekeeper's stump. Each of these structures has a purpose, from the small little bones to the sturdy ligaments, and when they're injured, they create specific signs for clinicians to look out for. For example, the tenderness or the pain around the anatomical snuff box after a fallen out straightened could mean a potential damage to the scaphoid bone, or some loss of laxity in the thumb, which could also mean a partial tear or a full tear to the ulnar collateral ligament. The bottom line for this presentation is just to tell us the relevance of the hand. The hand is a balance of mobility and stability, fine-tuned for precision and power. Understanding these not only helps in anatomy exams, but most importantly, it also gives us a real clinical scenarios to be able to understand the function and the structure that goes hand in hand to ensure what functions we're able to utilize with. And of course, this presentation wouldn't be possible without giving credit to the brains behind these facts. Before we round up, let's think about the quiz again. Now, my final answer is option B, which is the scaphoid fracture. And if you got that right, hit the like button so we could know how many of us are able to choose the right sections. And on this note, I say thank you very much for joining us today on Slides to Clinics. If you found this helpful, like, comment, and subscribe. And don't forget to hit the bell icon for more anatomy and clinical content delivered straight to your fingertips. I'll see you in the next one. Bye, yeah.